you're right now, how many weeks pregnant?
37 weeks tomorrow.
37 weeks tomorrow. Okay, so everyone, this is Rebekah. She's 37 weeks tomorrow, right? But you started coming to our office. Tell me about how did you find us initially, like few years back even.
I think it was an ad. I can't remember exactly, but it was one of your free consultation.
Right.
And I had been seeing a chiropractor. My husband's military,
Right.
So we had just moved, and I was 7 months pregnant with my last baby, and I thought, I need to go see a chiropractor, and took up that offer.
Right.
And that's how we started.
That's how we got started, right? Compared to, so that was the one pregnancy. That was the third one, the third little one.
My third little one, my second pregnancy.
Second pregnancy. First set was twins.
First set was twins.
And now,
Second set of twins.
second set of twins. Tell me more, how, because a lot of moms out there, the only time they realize the difference a lot of times is when they have their first set of children, right? First pregnancy. They didn't really get adjusted, right? And then this time around when they get adjusted, what did you notice? Tell me the difference. Because you're very few moms get to experience two sets of twins.
And definitely a difference. I started seeing a chiropractor with my first set.
Okay.
But it was late. It was in the third trimester, and I started seeing him motivated by really bad pain.
Right.
So he helped me get through, but it was just trying to cope through. This time around, the whole pregnancy, because I've been seeing you since before I even conceived, it was just, I felt physically like that the pregnancy is the least of my worries. Even running after 3 other kids.
Running after 3 other ones, carrying 2.
4 and 2, and just felt balanced, felt like very mobile. That was one of my issues with the first set. I was just so sedentary at the end. Mainly because I just hurt, so it was hard to get up and get moving, and of course now I have the 3 others that help motivate that too, but it doesn't feel as nearly as difficult. I'm tired, but in my mind I'm like, I'm 37 weeks.
Yeah.
I don't feel 37 weeks.
You don't feel it because you're still you're running around doing everything else.
And I feel really good. So and I can tell there's a few factors, but your chiropractic care is definitely one of the main ones that has affected that. So.
What would you tell other moms who are maybe, they're pregnant or thinking about getting pregnant, but are maybe a little hesitant to get adjusted?
I would say absolutely go for it.
Go for it.
Well, with the second pregnancy, I had my son inadvertently at home. His delivery happened faster than we thought, and both pregnancies so far, the first with the twins and then the second one, they both went to their due date. So I'm expecting this to
go all the way.
And I think that has a lot to do with it as well. And just the delivery, it'd be interesting to see the postpartum with these ones, because that was also extremely difficult the first time around. Whereas with my single, everything up to delivery, the delivery itself, and then even I ended up having a bad tear even after that. The post everything was just like, I was mentally there, I was physically there, felt very well prepared.
Right.
And my body was very responsive, and I think that made a huge difference and was worth the investment for sure.
I remember we were about to, thinking about, okay, we didn't get to take x-rays on the first set, because of course you were pregnant, right? And we're about to, almost done nursing, let's maybe take x-rays. And you're like, oh, Dr. Tam, here we are again.
Well,
that's good. That's how it should be. I think a lot of times in our world, especially in America, we think of pregnancy more of a handicap than anything. But you've experienced it firsthand where when the body works the right way, it doesn't have to be. And
I've always appreciated your approach because, like you're saying, a lot of it is so symptom-oriented and isolated. You know? So, you have a problem right here, let's fix this one problem. And pregnancy of all things is like a whole body experience.
It's just like the adjustment today.
Absolutely.
You're wondering, where's this tight in the shoulder coming from? You're thinking, what did I do? And it's not so much what you did. It's just, carrying a set of twins. That in itself can cause, all kinds of symptoms.
Yes, and the approach with nutrition and just everything is, it's very refreshing, because a lot of times with medicine here, you have to either see 50 different people and none of them know what's going on.
What the other really told you, right?
And you know, it really helps the whole health, so you don't have to take as much medication, if any. You know, you can really take care of your body, and then the output is just, has been incredible. So
perfect. Well, Rebekah, thank you so much for this
you.
interview, if you will. Yeah.
Thank you very much.
All right, we'll see you next time.